This is the 2026 MRC unit overview. In this presentation, we'll cover quite a few things, but primarily we'll focus on the following topics. So we'll talk about the MRC's overall mission, our history, some unit demographics, partnerships, benefits of volunteering, how to use ServPA/Juvare, which will be the majority of this presentation, and then some eligibility criteria, the volunteer deployment updates, and some routine activities that we have going on, scope of practice, data collection and reporting, and we'll move into some 2026 volunteer highlights. All right. Okay, so the Philadelphia MRC's mission is we are a national network of volunteers. We're organized locally to support health and safety of communities, whether that's deploying to support public health emergencies, including things like natural disasters, infectious disease outbreaks, hopefully not bioterrorism, but basically we like to be prepared for it all here at Philly. So our unit got established in 2005, so we just celebrated in 2025 our 20th anniversary. So we're very, very happy and excited to have reached this milestone. So it's 20 years of serving the public, 20 years of serving Philadelphia and its residents, and we're very proud of the work that has been done over the last 2 decades. All right. I'm going to talk a little bit about the MRC map and kind of who we're all comprised up of. How far does the MRC network really span? So our unit is just one of many. There's about 800 community-based units in the country or nationwide. But together, the National MRC is about 300 plus, 300,000 plus volunteers strong. So that's a huge number of just wonderful individuals like yourselves who come out and dedicate and volunteer their time and skills. And this is just a representation of what the map as a whole looks like. So you can see that there's volunteer units ranging from Guam, Palau, Hawaii. So pretty much anywhere you go, you can become an MRC volunteer. It's just a matter of finding a local unit that you can join and getting started. All right. So some of our history here. So, like I mentioned, we got our start in 2005, but the original MRC was actually founded in 2002 after the Twin Tower attacks on September 11th of 2001. 2020, I'm sure everybody's tired of hearing about COVID as much as you're tired of talking about it. But 2020 was a huge year for us. We were rapidly mobilized and deployed in a numerous or excuse me, in a multitude of different volunteer deployments in terms of screening. We did drive-through testing. We were actually one of the first volunteers, actually helped set up and staff one of the first drive-through testing sites in the city during that time. We did the Operation Allies Welcome response. A lot of things happened between 2020 and onward. So leading to my next point, something I briefly just mentioned. So in 2021, we supported the Operation Allies Welcome, which was held at the Philadelphia International Airport, secondary to the response that had happened in Dulles, in a larger response to all the displaced Afghans who were seeking asylum in Philadelphia specifically for this response. So we had little to no time to kind of rapidly mobilize and deploy volunteers to be at PHL. We provided, I think it was 13 consecutive days of 24/7 support from MRC, ranging from line staff to we had interpreters, different type of translation services. We had folks doing screening and triage and vaccinating and you name it. We helped with it. So that was a very large response that we were really proud to have been a part of. And then, as I mentioned, in 2025, we celebrated our 20th anniversary for our unit. So we just love talking about that because I don't know how many units have celebrated that many years, but I think we're one of the few that have reached that milestone. So really proud to share that. All right, and now I'm just going to briefly turn it over to Sonia so that she can talk about the volunteer snapshot. And then I'll take it back when you're ready, Sonia.
Cool. I'm just checking if you can hear me now. Can anyone in the chat verify if they can hear me? Okay, so I'm seeing thumbs up, so maybe it's just on Satori's end that she can't hear me. But so yeah, I'm just gonna breeze through this part. It's a volunteer snapshot, basically depicting the volunteer count. So we firstly have over half of our volunteers are clinical professionals. Following that, many of our volunteers are non-clinical but work in the field of public health. And then finally, non-clinical folks. So that could be anywhere from teachers or gym instructors, just anyone looking to dedicate their time. And I'm going to pass it back to Satori, but I'm not sure if she can hear me. One second. I can take this one too, if you'd like, but
Thanks, Sonia. Sorry, I have to figure out what's going on with my audio because I can't hear
it's
you.
okay.
But all right, for the MRC partnerships, the three that we mainly like to highlight is the Office of Emergency Management, who typically helped us a lot during COVID, transporting a lot of our logistics and supplies to and from different locations and sites. We also work with them when we do first responder flu clinics in the fall. And then we work closely together with the Philadelphia Fire Department, primarily to support a lot of the special and large scale events that happen in Philadelphia. So, as you can expect, to see many of the America 250 events going on. Um, and, we have Roots coming up, we have FIFA, we have Wild Wild 4th of July, we have it, you name it. Or you name it, we have it. We work with them very closely. We support them by providing supplemental staffing support inside of their EMS and medical tents at all large special events. So that's how we're able to get into, you know, really cool events like the Roots Picnic, others like the Broad Street Run, which we just completed the first weekend in May. We do the marathon every fall. So yeah, lots of partnerships going on here, and lots of ways that we can support each other. So that's great. And then the police department, we support them every year by doing two first responder annual flu clinics, which is a test and an exercise really for our staff at the health department, but also for our unit as volunteers, just to see how rapidly we can quickly mobilize and deploy you guys if we really needed to send you out into the world to inoculate first responders in response to some real world event or public health threat. So it's a great way to kind of get that experience, whether you're a clinical or non-clinical volunteer, to kind of see what a real clinic looks like and what it would really look like in a real world scenario. Should we ever need to use it, which hopefully we don't. But we do two of those each year. We provide flu shots to first responders, their families, and friends. It's a great opportunity to network with like-minded individuals, like I said, gain that experience and to see operations firsthand. All right. So this is just for everybody's background knowledge. This is what an MRC request form looks like. We have an electronic form that's filled out, whether it's a requesting partner like the fire department, who typically fills it out, or another requesting partner, maybe someone internally who needs support with like outreach or canvassing or some other deployment regarding that. What they'll do is they'll fill out this form. They'll give us all the information we request from them, which is all the information we end up giving to you guys whenever we send out those interest surveys or when we create those missions in GVRA, which we'll talk a little bit more about. But this is where that comes from. So we don't just create or curate, these special events or deployments. We have to be requested before we can actually respond. So once these are submitted, what happens is we review them internally, determine and discern if they're appropriate for our volunteers, you all, to respond to. And then once we approve the volunteer request, we then start to process that. And then that's when we communicate all of you, or communicate all that information with you guys, so that you're able to sign up for deployments that interest you. All right, so now we're going to talk a little bit about the benefits of volunteering. They're pretty straightforward and simple. You not only get the opportunity to build and expand upon your already current skill set, but you'll get to gain additional skills that you'll be able to utilize to service the community and service the city when you're, deploying out with the Philadelphia MRC. And then additionally, deployment experience. Invaluable. No deployment really looks like another unless it's something routine that we do every year. Then we can kind of expect what to anticipate when we arrive on site. But in large part, arriving or attending any type of deployment is great experience. You really get to see the operation sides of things, the chaotic side of things, the fun side of things. It's a really well-rounded experience for volunteers to apply some of those skills that you've gained in real time and to also kind of just see how everything comes together. We do also like to provide free certifications as much as we're able to. So that could be continuing education credits, or we also provide certifications for both Stop the Bleed and CPR. So we like to give those out as much as possible to the folks who are eligible to receive those. And if you have any questions about that, you can always feel free to reach out. But we'll typically always let you guys know what we're able to offer so that you guys are aware. And then for training opportunities, for we offer a multitude of both virtual and in-person trainings. We do free giveaways, and we also offer a lot of different networking opportunities, whether it's via deployment or whether you guys come to an in-person training. All right, those are just some of the benefits of volunteering, and I'm going to turn it over to Sonia, who's going to talk a little bit about how you can get better communications coming from Juvare/ServPA and how to go about setting that up. Sonia?
Thanks, Satori. Being a part of the Philadelphia MRC essentially means that you receive mainly our communications through your inbox. But to receive similar text messages, like Satori mentioned, sometimes there might be a short notice deployment or where we have to mobilize rapidly. We suggest that everyone sign up to receive text messages, and they can do that in their Juvari profile. You can navigate to the personal info tab and select both text and voice, which is the photo to the right. Make sure that they are both checked off and that your phone number is correct and that it can receive text messaging. Otherwise, a really easy way is just to text the word start to 85079 or that full number, whatever you prefer. But that essentially just lets you receive our most up-to-date communications. Okay, pass it back to Story.
All right, thanks, Sonia, so much for that. Um, and now we're going to actually talk about the volunteer deployment process. And Sonia, do you actually mind taking this slide as well?
Yeah,
Yeah,
absolutely.
absolutely. Thank you so much. And I can hear you now magically. I don't know what happened.
Oh, good.
Thank you.
So this is essentially just the volunteer deployment process. The first is, like we talked about, you have to be a registered MRC volunteer and select Philadelphia MRC as your organization in ServPA. Then, like Satori previously mentioned, based on the request that we get for volunteer support, we will then survey you all through Juvari by creating a mission that you can sign up for. If you are selected to deploy, you will then receive a acceptance email with a deployment summary. And that deployment summary has all of that really important, pertinent information that you may need to respond effectively to whatever special event that we're supporting. The next is signing volunteer waivers. So, luckily, this only has to be done once, but all volunteers must sign both liability and confidentiality waivers and then return them to either Satori or myself or whoever the on-site point of contact is for that deployment. The next, once you arrive on site, you'll receive a just-in-time training, also known as a JIT, that really just outlines your roles and responsibilities for the day and describes your scope of practice. And what that means is the scope of practice is that non-licensed, non-medical volunteers cannot perform medical tasks, and if you are licensed, you must stay in your scope. And we'll talk a little bit about that later. And then, of course, if you have any questions on what that looks like or need help or assistance throughout the day, there's always going to be an on-site point of contact. And typically that is Satori or myself or another PDPH employee. Okay. So this is what the deployment summary looks like. So once you have been selected, you'll receive this, and it is really important that if you do choose to deploy, that you respond accepting the deployment. But like I said, it can be a little lengthy, but it does have that essential information and the scope of practice. And it's really important to note that volunteers cannot deploy without receiving this deployment summary. Okay, medical authority. So when volunteers are out in the field, they do support all unit activities and they act under the license of the medical director for the Philadelphia Department of Public Health, Division of Disease Control, and that is Dr. Shara Epstein. And medical volunteers are permitted to support PDPH events or City of Philadelphia events with the Philadelphia Fire Department in their EMS medical tents. And these requests, like we showed you before, do get submitted to Satori, our MRC volunteer coordinator, and then that is goes through a review process by our division director, Jessica Com. So, what are the deployment do's and don'ts? So, we want to make sure that we're not self-deploying, and then that we're not no showing or no call, just so that we can plan accordingly. So, if you are feeling sick or ill in any way, you should definitely stay home and notify the MRC coordinators or the point of contact for that deployment. We want to make sure that you do not act outside of your scope of practice or misrepresent the MRC, and that you do not speak to the media. Sometimes at these special events, media will come up and ask for a comment, but it suggests that we say no comment or nothing at all, and then notify Satori or myself or whoever is on site that day. Um, Next, we want to make sure that you do confirm if you'd want to accept the deployment and that you only deploy when you receive your deployment summary.
Thanks so much, Sonia.
Yeah, no problem.
All right. So now I'm actually just briefly going to touch on this slide. So this is the May calendar of what it currently looks like. So right now is the 18th, so we're at our unit overview and orientation session. Um, We'll have a few other trainings. We actually have a Roots picnic info session for volunteers who are selected for that. That'll actually be on the 27th, not the 26th. We updated that. And then the first day of Roots will be on the 30th of May. So this is a calendar that typically we like to provide when we do mostly in-person trainings, but also virtual trainings as well. We'll try to include these as much as possible moving forward, just to give everybody a visual kind of idea of what to anticipate and expect as we move forward in some of the warmer months with some of the events that we have planned. So this is just to give folks an idea. I'm actually going to go through. Awesome. All right. So just kind of given, all the volunteers who've done the wonderful work in the past maybe like what 6 months that we've been in 2026. You guys have done a lot for us and for the city, and we're very, very grateful. So in 2026 alone, volunteers have saved the city over $30,000, and that is no short feat. That is no small number. Every volunteer counts. Every act of kindness that you guys do when you're out in the field deploying, it matters. When we deploy volunteers as supplemental staffing support, so for instance, at the Roots Picnic, we are saving the city money. We're saving the city taxpayers money by not having to pay overtime for otherwise city workers that would, we still need first responders to respond to emergencies in the cities. And so not everybody can support all these special events all at once. And so it's really important to have you guys out in the field because that means that the workforce capacity for a city response as a whole is a lot larger. So I can't stress enough how important you guys are and helping the city do all that it does. As of right now, we have a little bit over, I believe it's right around 5,300 volunteers. That number continues to fluctuate. As we get into summer months, we'll continue to get, more volunteer interests. And we'll also do as much as we can to retain your interests as well. So we like to offer as many deployment opportunities to as many volunteers who sign up for them as possible. As of today, we've deployed over 169 volunteers. That number will continue to grow. Volunteers have logged over 571 hours, and by volunteer hours served, all of the work that you guys do when you're out deploying, again, it does matter, and that does get recorded and reported to the state, so that we can show them on a state level, on a federal level, how important and impactful the work of volunteerism really is. And what we also do now that we have this new fancy Jivare system, is when you guys sign up for missions or deployments in the system, we can add those deployments directly to your profile so that you can see how many volunteer hours you personally logged. Just if you, in case you need it for anything or just if you were curious, but we do now keep track of that across multiple platforms. So it's great that we're able to track that. And then we've also offered 11 MRC trainings, both virtually and in person. We like to keep you guys busy and engaged as much as possible with useful trainings that have actual information that may be applicable to your lives in some way, shape, or form, or help you prepare for hopefully an emergency that never happens. So, in-person virtual trainings, we're going to continue to push those. We're really excited to actually announce now that we'll be offering more routine CPR training. So if you guys are interested in that, feel free to check out the Jivare system that we'll go over in a couple minutes. Sonia put together a really great list of all the dates that we have currently available for anybody who wants to sign up for CPR. It's $3.40 on a Saturday, 9 p.m. or 9 a.m. to 1 p.m. But yeah, if you guys are interested in anything like that, or if there's a training that you're not seeing that you'd like to see, or something you'd like to see more of, just let us know. We're happy to, kind of tweak the training curriculum a little bit to be what you need. And so yeah, that is our 2026 current unit volunteer highlights. All right, so we just went from highlights to emergencies. A little drastic, but basically, you guys are great while we're out in the field. We've never really had any emergency in my 7 years here, which I'm very thankful for. But any instance of any type of emergency, you guys can reach out to me or the MRC phone, contact me, and then we'll deal with it as we need to. Okay, and I believe this is the contact information. And one second, I'm gonna stop sharing my screen. And I'm gonna pull up the new information that we just spoke about. One second. But thank you for listening so far. Please hold. Are you guys able to see my screen?
Yes.
A bit of a show and tell. Okay, great. Okay, so my view will look just slightly different from what you guys are seeing, because this is an admin view, but when you log into your Serve Pre profile, it should look something like this. And if it doesn't look anything like this and you guys are seeing something completely different, please let us know, so that we can address that on the back end. But essentially, what will happen is as we post deployment opportunities, they'll pop up here in your notifications or your homepage. But what you guys really want to do is click on this flag icon right here. This is your missions tab, aka deployments tab. This tab will house all of our current active deployments, opportunities, whether it be outreach. Here you have the volunteer CPR that I mentioned, that training that we're offering. If you guys were interested in FIFA and you signed up, that'll all be right here. Folks, as can see, folks already started signing up for a lot. But we post everything here. We're trying to centralize everything to be in one location so it's easily accessible, and we're navigating the user-friendly side, okay, to make it more user-friendly for you guys. So, when you log in here, you'll be able to click on any open and available opportunity to you that's presented by us, whether it's canvassing, whether you want to sign up for a Stop the Bleed training, that CPR training I mentioned, or even something like Roots. And so what'll happen once you guys sign up, you'll be in a little pending section. That is because we have to still look at that request form that we spoke about earlier, compared that with what we have in front of us in terms of the volunteers that signed up, and then we staff you guys accordingly. So we do it on an equitable basis, as equitable as we can be. But we also keep in mind that certain requests, come in for certain numbers of clinical volunteers versus non-clinical. So that is what goes into it on the back end. Um, you guys, once you are approved so let's say you signed up for Wawa, you were in the pending section, and then we approved you. You'll be moved into an approved section. You'll get notifications, or you should be getting notifications for all of these things. Um, and then what we do is we send you, and I'll show you. Here are our notifications that we send you guys. So earlier today, Sonia sent out the newsletter. I'll actually show you what that looks like. So she sent out a newsletter. This is what it looks like. It'll have the text and the link and everything that you'll basically need for the deployment. Um, this is what we're operating out of. This is what we can see you guys if you want to message us in here. We can see that too. If you guys respond to certain emails, we can see your emails and your confirmations, which I won't show. Um, but this is the system, again, that we're primarily functioning out of. This is how we'll send you future deployment confirmations, opportunities, you name it. This is how we'll send it. And we'll also be utilizing our MRC phone as well for confirmation calls or reminder texts. So with that being said, does anybody have any questions for us? I know that that was a lot of information that we just went through in about 30 minutes. So if you have any questions, feel free to ask. If not, here's our contact information. Like I said, always feel free to reach out if you need us for anything. Um, but otherwise, thank you for your time. We very much appreciate your volunteerism and everything you do and continue to do the service to city. All right, I'm looking at the chat now. I see some questions. So currently, we are not permitted to allow pharmacists to vaccinate. That's just the guidance that's been provided to us by our leadership, and that I'm not too sure why that is, but as of right now, I believe it's nurses and physicians, and I believe that is a it would have to be our medical authority. So volunteers who are clinical operate under the medical authority of the acting PDPH um, clinician, who is Dr. Shara Epstein, and she makes all the decisions as to who, is allowed to practice under her license, and it just depends on what leadership is comfortable with. Um, so yeah, sorry, I had a bad answer for that. So I can't give you her email directly, because she is the medical director for our, Department of Health. But what I can do is, if we can chat offline, I can put you in contact, or, ask her any questions that you may have, to kind of see if we can get you more answers. Okay, so how should volunteers dress for deployments? So basically, if you have MRC apparel already, we encourage you to wear it. If not, we will always be providing some form of uniform or apparel for you. So whether that's the brand new MRC vests we just got, which are lightweight mesh zip-up vests. They're durable, they have little pockets in them. They have our logos on them. We're pretty known for them. And they're breathable too. So like when we're outside, especially in the warmer months, they'll be comfortable to wear. And so, yeah, that's pretty much it. We'll either bring you t-shirts, whatever you need, or you can wear whatever you have. But we do encourage you to dress comfortably for all deployments. Bring your sunscreen, bring your water bottle, bring your comfy shoes. If you're a clinician, you have a stethoscope, feel free to bring that too. But otherwise, all other materials will be provided to you on site. All right, any other questions? Or anything that anybody would like me to kind of dive a little deeper into?
Yeah, does anybody have any Duvari specific questions? We can definitely assist if you guys have any questions related to that as well. The contact information, yes.
You're guys still able to see the screen?
Yes.
Cool. And we can utilize the rest of this time however you guys want. So if you want to ask questions specifically, about Juvare or anything really, this is your time. So we were happy to go in any direction. Okay. Let's see. Okay, so the question is, should we accept deployments in Juvare only or also email the MRC email to confirm? That's a very good question. The way we have it set up with our new system is you can respond, like it'll say I accept this deployment. You're more than welcome to respond that way, and that counts as well. As long as there's some form of response documented, that's all we need. So whether, you can defer to your preference, whether you want to call and confirm, text us and confirm, you can email and confirm, or you can respond directly to that Juvare email and it'll log your response that way too, so we can see that. And we're still working out some of the kinks, so we very much apologize for blasting you guys with all the emails and information and stuff. This is a new platform, so we're just working through it, trying to make it work for us and work for you guys as best as possible. So let us know if anything's working well, if it's not working well, and we'll see what we can do on our end. Okay, any other questions? Does everybody know how to get into Juvare? Has anybody even re not receiving our emails? Oh,
One thing I thought of, Satori, if you want to quickly show volunteers maybe how to upload their certificates in Juvari, I feel like that might be a little confusing.
sure. All right. So you should still be able to see my screen. I am going to use myself as an example. Okay. So if you want to update, let's see.
It's under qualifications, I
Yeah.
believe. Yeah.
Yeah.
So if you click that button that says add training course, if you say go to a Stop the Bleed training that we offer or a CPR training, you can enter all of that information yourself and you can also upload your certification. So if, anything happens to your computer or, technology tends to break, at least this is just a safe place that you can upload it. And then for us, for our tracking purposes, we do suggest that you upload any courses that you've taken, just so we have that record. Thanks, Satori.
Yep, no problem. All right, any other questions? And if you guys, if nothing comes up, okay, wait, hold on. Okay, not seeing anything in the chat. But if anything we mentioned, sparks a thought later on, feel free to reach out to us. We're happy to have conversations one-on-one or walk you through something one-on-one if that's a little bit easier. This platform, you just have to click around and kind of play with it a little bit and it'll get easier as you use it. But once you get into it, it's very easy to kind of navigate and to kind of figure out where things are once you, like I said, pick through it a little bit. But we'll come out with a recorded training specifically about all the ins and outs of GRA and how to do certain things, like Sonia mentioned, like upload certificates or sign up for different deployments. We'll create kind of like a dummy account so that you're seeing what it actually looks like on your end and not just the admin view that we have here today. But we'll really dig a little bit deeper as to all the things that you can do by utilizing this platform to the best of your ability and just make it work for you. So with that, I will stop talking your ear off. More than happy to give you guys some time back on, your Monday evening. It's nice out. Hope you guys enjoyed the weather. Enjoy tomorrow. I guess the day after that. But we'll be here. So let us know if you need anything. And thank you. Anything else on you?
No, that's it. Thanks, guys.